let's discuss now. Let's discuss the case that I have shared to you about the ethical concern. So if you can notice, there was an ethical concern there raised. Okay, you can see my whiteboard on screen. It will just be half screen. I'm opening the case here inside. So the case is just to tickle your brain. So this is how we present the case. It's a 50-year-old female on day 30 of the hospital, and then she was admitted through MVA, so motor vehicular accident. The son is 12 years old, the daughter is 18 years old, and then they were able to survive the car crash. And however, the patient is GCS3. In other words, when I say GCS3, is the patient in good condition or worse condition?
Worse condition.
Hi. So the condition is not good. No? Basically, the condition is not good. Because if you can recall, when I say GCS, what's the minimum score of GCS, guys?
Glasgow Coma.
Yes, your
Three,
GCS
sir.
is Glasgow Coma Scale. Very good, no? So your GCS is your Glasgow Coma Scale. And then the lowest score for your GCS is 3. What's the highest score for your GCS? Okay, I can see from your mouth, you're saying 15. Okay, so you have GCS 15. Okay, you can use the chat box also if you would want to participate. So looking at the condition of our patient, from there, we can already judge as nurses that our patient is comatose. Okay, our patient is actually considered a patient on coma. Okay, plus how do we quantify coma? As healthcare professionals, your coma means GCS 8 and below. Okay, your coma means GCS 8 and below. So from that on, you can deduce that your patient has a poor prognosis. Okay, we usually say this patient would have poor prognosis. Okay, what's prognosis? Can anybody tell me what's prognosis? Sige, what do I mean by prognosis?
Okay, Mariacto, sir.
Yes, go ahead. Yes, John.
Ang ano, sir, ang imong prediction. Ang predictions ang imong sir, sa patient mo after you done the diagnosis and intervention.
Okay, yeah, that's correct. No? So it talks about somehow your prediction of the possible outcomes of your patient. Okay, of the possible outcomes of your patient. So in this case, we are saying it's poor prognosis. So we can say that, oh, after treatment, bakit parang mahina parang yung recovery ng mother? Okay, so we can say that the patient has poor prognosis. Now, the husband is deciding whether to sign the DNR form or not. Okay? You know what? You had valid answers for this. Okay? Some of you are agreeing, some of you are not agreeing. And it's okay. Huh? You might be wondering, what's the correct answer? No, that's not the point of this activity. The point of this activity is for you to decide if what could be an ethical decision to be done. So some of you are agreeing and some of you are disagreeing. So if you would look at it, maybe the first question that you ask yourself is that, is the husband allowed to decide in behalf of the wife? Okay, that's the first question. Can the husband decide in behalf of the wife? And your answer would be? If your answer would be, can the husband decide for the wife?
Sir.
Okay,
Yes, sir.
I can see your responses on chat. Okay, many are saying yes. Okay, and that's correct. First class, the husband has the legal decision-making power for this case. Okay, in other words, class, the husband may be able to decide in behalf of the wife. Okay, legality-wise. Now, the next question there is, okay, where's the question? In a while, I'm looking back at the case. Okay, I think what you can see is my whiteboard, no? Okay, so first question is, okay, as a nurse, would you agree to the decision for the DNR? Okay, now, I posed this question and some of you are answering, okay, no, I don't want to agree with it because it might be too cruel. Okay, may ara man nagsabat nga, yes, I would agree to it because naluoy na ko sa mother. I don't want the mother to suffer anymore. Okay, and then others are saying, yes, I would even recommend, I would even agree with the DNR order. Okay, so there are a lot, no? There are a lot of people with varied ideas and varied opinion regarding this. Let me see another one. I'm looking at your responses right now. Okay, somebody said also I am agree, and if I'm the husband, I will have the DNR because I don't want my wife to suffer the critical condition. Okay, that's a good answer. Now, let's go back to the question. As a nurse, would you agree with the decision of the DNR? Okay? Subong, it's a question in your ethics class. Okay, you're free to answer yes. You're free to answer no. But allow me to put it in a context. Let's place it in a real situation. You are an RN dealing with above patient. Okay? Actual situation. If you will be asked, for example, by the husband, nurse, ano maayo? I-DNR ko si Mrs. or hindi? What would be your best response? What would be your best response? Sige sir, i-DNR kay para makapahuway si Mrs. Or hindi sir, hindi sir pag DNR si Mrs. She's very beautiful. You deserve to have another child with her. What do you think will your response be as a nurse? Can somebody try?
Very up. Can I try?
Sige. John, I'll give the floor to Lian first. Okay? Lian, yes. Lian
Okay.
Rose.
For me, sir, I would not I cannot say anything, like I cannot agree or disagree. I just have to be my patient's advocate, sir. I have to be the one to tell him what is the pros and the cons of signing the DNR. So, dapat, sir, safe lang. Well, hindi mahatag sa imong own opinion. You have to just tell the patient or the husband kung ano ang consequences ng iyang actions if he will sign or not, sir, sa DNR.
Okay? Okay? Sige. Other ideas muna before I would give my piece. John, would you want to say something?
Yeah, it's correct, sir. Ginambal ni Ms. Gallardo, as a nurse or as a registered nurse in that situation, it's not nga mahatag sa opinion ta, but as a registered nurse, we should be an educator if what is DNR, i-educate mong husband kung ano na siya and ano matabo kung nasa siya sa DNR, and also ang ato naging nga role, sir, is amo sir hindi ta maghatag di opinion ta nga para sa example mo nga i-DNR siya na hindi pa din siya mag-suffer sir.
Okay, sige. I'm getting your point. Sige, others, what are your input? Others, would you want to give an input? Sige, I can see a raised hand. Yeah, Samantha. Go ahead, Samantha.
Actually, sir, this is also similar to what Casey and Ian said, because what I put also in my own work was that we should also go back to the the core ethical principle of autonomy, which is the right to self-determination, because it's not, although we all have our own thoughts personally, but as a nurse, it's not in our own responsibility to be able to um influence the patient's decision, because as a nurse, our responsibility in cases like this would lie in making sure that the client is adequately informed and thoroughly understood their choices and circumstances, because as mentioned, it's not in our right. Who are we to tell them what to decide?
Okay. I appreciate all of your ideas and I picked these 3 words, or phrases to capture those ideas that you've mentioned. So you mentioned about patient advocacy. And true to that, the principle of autonomy is actually the basis for being a patient advocate. Okay, so I think you mentioned that it's their decision to make. And then you've also mentioned that we should hold our opinions in situations like this. Okay? But come to think, you're the nurse and then the husband approach you. Nurse, ano mayo? Will I do DNR for my wife or not? Okay? Diba, if you're placed in that situation, human as we are, the tendency is that you will answer, sir, daw pigado na gid si Mrs. That's oftentimes the response kasi that I would hear. Okay? But I hope that you will stay true to what you've said here in class, that you will hold your opinion. Now, question naman is, sir, paano naman i-approach? Is it good for me to say nga, sir, sorry, we could not speak of our opinion. Pero ang itsura mo sad. Tapos balanon, gid nga, you disagree. Or, sige sir, sorry sir, but I am not allowed to share my opinion. But then you are very supportive. So how will you approach, no? Okay? So guys, one thing that we can say is that, sir, do you want to talk about this? Okay? Sir, I'm here to listen. What are your ideas regarding this? Okay? Then you just allow the husband to speak out. Because oftentimes, the problem is not choosing about yes or no, but the problem is that they have a lot of emotions that they need to pour out. Okay? That's one. So pag may mag-approach sa inyo later on, and if you will be placed in that situation, the best approach is, sir, I understand where you are coming from. What made you decide? Or what made you think about this? Can you tell me more about it? Or for example, if the patient approach you in the ward wherein there are a lot of patients, okay, you can say, sir, would you want to talk in a private area? Or would you want to go to the conference room near our nurses station so we can discuss this? Okay? And then if the patient or the husband will really be deciding about it, the next best thing for you to do as a registered nurse is, after you talk, the next best thing is, sir, I need to inform the physician about this. And I would want the physician to talk to you about the benefits and risks if ever you have decided so. Okay? So from your end as a nurse, you allow your patient or you allow your client to verbalize feelings. Okay? Allow client to verbalize feelings. Take note, I use the term client because when I say client, your client is not only your patient, the wife, but in this time, your client is also the husband. And may imagine your class, try to think of the situation that the two kids are there crying and waiting for their mother to come back. Diba? Kasi GCS3, it's comatose. Okay? So you will witness situations like this. And the question here is actually intended to remind you of the legal responsibility of the nurse. And you were able to answer me right in this live discussion that we hold our opinion. We are not supposed to give our opinion, but we allow them to verbalize their feelings. Okay? Sir, paano kung yes or no ang sinagot namin sa activity? It's okay. It's not intended to determine right or wrong as of this time. It's only intended to tickle your brains. Next, if you are the husband, by the way, sorry, I'll go back to one. Another responsibility that the nurse can do is that the nurse can witness the DNR. Okay, as a nurse, you can be the witness for the DNR. When I say witness, hindi witness na ikaw yung mag-video tapos i-post mo sa Facebook na nag-DNR siya. What I meant by witness is that the legal witnessing. Okay? So you can sign the document that you have witnessed that the DNR was executed by the husband and that the husband is in a right state of mind when he did the decision. Okay? That's one thing that you can do. Witness. Okay? Pero, by the way, side gamay, okay, a little side, you cannot witness if ever you are in the will and the testament. No? Several instances kasi this has happened to nurses already, especially abroad, wherein, for example, you are the nurse taking care of the patient, and then the patient has no other family member, or ang family members, yung mga kabataan, naka-separate homes na, tapos wala nang pakialam. Kasi that happens, no? That happens in the culture abroad. Diba? They usually separate from their families, and then the old would grow old. There will be a nurse and then stay at home until the day that he will die. So oftentimes they would leave their estate to you, as in the entire home along with the entire property. Okay, that happens. I've heard of several cases of that, true cases of that. So you are not supposed to witness the will if you are a recipient of that will. Okay? For example, pag sinabi niya, I would like to give my $5 million estate to nurse ABC. If you are nurse ABC, do not witness. Do not witness or else it will not go to you. Okay? Something like that. Okay? Now, bakit nila class ginagawang donation to you? Or why are they giving that to you? Because class, if they will not be giving that to you, okay, the tendency is that the state, the government, will get their entire property. So kaya binibigay nila kay nurse. Okay? So as your teacher here in ethics, I'm telling you, do not witness that document or else sayang naman. Okay? Tapos pagbigyan kayo class, kahit chandelier na lang yung i-donate nyo sa, okay, kidding aside. So I hope that you got something from that. Okay? Now, let's go to the second question. If you are the husband, what will you do? Okay? Somebody saying, if I'm the husband, I will have the DNR because I have a kabit waiting for me. Ganon. Okay. Pati, wala man may nagsabat nga muna, no? Yung may ara nga naghambal nga, if I'm a husband, let me see. Additionally, I will not make any decision. Okay, so he would want to talk to the physician. If I'm the husband, I would opt for DNR. Okay. You know, class, why do you think the husband is asking that question? It's not because he does not know how to decide. Okay? Especially if it's a college graduate, he knows how to decide. However, class, what do you think is the main concern? Why will the husband be asking your opinion? Palagay nyo. Let's say that the husband is educated, the husband understood, kahit hindi pa siya healthcare professional, let's say college graduate siya, na-explain sa kanya yung condition ni Mrs. But why is still the husband asking your opinion? What do you think is the reason? Sige na, put it in a scenario of a real life context. Okay? Professional opinion could be, or second opinion daw. Tama? Bakit? Bakit kailangan yung humingi ng second opinion? Okay? Yes, somebody is raising hand. Elisha. Is it Elisha?
Yes, sir. Try ko lang, sir.
Yes, go ahead.
For me, siguro, sir, is para ma-make sure sa husband, sir, if sakto ang decision nga i-make niya, sir, if ang mag-sign siya sa DNR, it will, or hindi man, ang may sakto bala, sir, ang iya decision. Sakto man tangabal ni Rana ang professional opinion or second opinion para ma-make sure niya lang gid nga sakto ang iya decision.
Sige, tama. It's to make sure of the decision. Okay, and you know what other thing is that they're avoiding the blame game. Okay, they're avoiding the blame game. Okay, they don't want to be blamed. Okay, remember that it's not the husband. The children will be there. Okay, the family of the wife is another thing. The family of the husband is another thing to deal with. And oftentimes, they are placed in a situation that did they make the right decision? Okay, the blame game is always there. Okay, this is not textbook based, but this is what I see in the clinical setting. Okay, that's where ethics would come in. Okay, that's why you don't just say, oh, ethics, just do good, because doing good is easy. Okay, when you say do good, it seems to be easy, but if you are in the actual clinical setting, it's a very difficult thing to handle. Okay, so that's why we have lessons on this. Okay, so that's why you allow the husband to verbalize the feelings, because from that you will be able to understand. Okay, sometimes they will say, nahadlok lang man ko kay basi basulon ko nila. I know that she has decided if ever this will happen, she has already told me that we will have the DNR. However, nahadlok lang ko nga basulon ko nila. Okay? I've encountered cases like that, especially among cancer patients, wherein pag cancer kasi class, especially if it's a good marriage, the husband and wife, rest assured, are talking to one another. Okay? May plano na kung ano matabo sa ako na muni obrahon. Okay? The wife would usually say. But then when the situation comes, the husband would still have difficulty. Okay? Next, what are the roles of nurses in cases like this? I think we've already mentioned. So you have your patient advocacy. Okay, you have your patient advocacy, then you have your autonomy. So those are the important things that the nurses would need to do, okay, in situations like this. Okay? So, dear students, this is just a simple example, okay? Simple example of an ethical dilemma that you might encounter in the clinical setting. And as a nurse myself, one thing that I can tell you is that you should learn to separate your emotions from your work. Okay, you should learn to separate your emotions from your work. Okay? Because in this case, we are in the art of caring. We are in the art and science of caring. And when I say caring, it's not just simply bringing food on the table. It's not just simply wiping the butt of your patient when there is feces. It's more than that. It's more than that. You're handling more complex situations. You're handling the lives of your patients. So that's why you need to be able to decide ethically well. Now, let me put you again in another question. Let's say, for example, that a family member of yours needs medical attention. Okay? Family member of yours need medical attention. And then you are in duty on the hospital. Okay? You are on duty in the hospital. Then you receive a call. Hey, somebody from the family needs medical attention. Question, can I leave my duty and then go to my family member who needs medical attention?
No, sir.
Okay? Sige. How about others?
No, sir.
Okay? So, there, you're giving me the no. You're giving me the ideal no. Okay? Which is, of course, the answer that I expect. It's a no. But come to think of it and come to picture a real family member knock on the wood. Okay? It's a difficult situation for you to handle. And I tell you, I saw nurses who are there on duty who goes blank because their child is admitted, who goes blank because their parent is about to be admitted in the emergency room. I've seen cases like that. Nurses who could not focus at work because they know they could not leave. However, they have no choice. However, their attention is still with the family member, okay, who gets admitted. So what will you do? Diba? Kasi we are teaching you, no, you should not leave your duty. Pero place yourself in a real situation. Okay? Will you just forsake your family member who are there in the hospital? So class, you have remedies naman for that. Okay, what you can do is that you need to inform your head nurse and you need to inform your supervisor. And you can tell your head nurse if he or she can look for a replacement for you for that shift. So let's say, for example, 7 to 3 is your duty. At 9 a.m., you receive the emergency call. So you can tell your head nurse, Ma'am, can I have somebody to substitute? Okay, I'm not really feeling well about this and I need to address my parent. Okay, I need to address somebody from the family who is admitted. And then, okay, you wait for that replacement and then you go and attend to your family member. Okay? See, that's something that is within our profession. You can just pareho sa iba, no? If you're doing office work, you drop your office work, you go to the hospital because you need to take care of your family member. But this time, since you are the one taking care of the other people, you can't just leave them. Okay? So you need to endorse it before you leave. Okay? So, tama ang sabat ninyo. Your answer is correct. No, don't leave. But then, I'm offering you an add-on or a substantial, what do you call that? A supplement to that you can leave as long as you have informed your head nurse. Ay, para nga real situation tayo mag-approach. Sige, you have any question